Experiencing knee pain can be very frustrating and limit your overall daily mobility. It can be caused from several different factors, such as a traumatic injury or an overuse type of mechanism. In this video, we're going to go through potential causes and treatments that can help combat your knee pain. My name is Franklin Staples, and I'm a physical therapist with EW Motion Therapy. I've helped several patients overcome their knee pain. We have been able to diagnose where their knee pain is coming from, and then we've created a linear structure and progressive overload principles to help improve their daily function and strength. Today, I want to review with you the anatomy of the knee, causes of knee pain, and how physical therapy might be able to help you. The knee is a complex hinge joint with two main functions: to extend or straighten the knee, and flex to bend the knee. It has two main muscle groups that accomplish these movements: your quads, which are on the front of your leg, and your hamstrings, which are on the back of the leg. The bones that make up your knee joint are your femur, your tibia and fibula, and your patella. Other aspects of the knee in terms of anatomy are your ligaments, and these are passive structures that aren't actually active but are always working. And that can be the anterior cruciate ligament, the posterior cruciate ligament, the lateral collateral ligament, and the medial collateral ligament. And the last important anatomy piece of the knee is cartilage. And there's two main cartilages of the knee that are very important to daily function. One is the meniscus. The meniscus is a shock absorber that, when you hit the ground, helps absorb that load. And then you have hyaline cartilage on the end of long bones, which helps that knee move fluidly and not cause any cracking or buckling. So all of these anatomy pieces of the knee come together to help you function, whether that's walking, twisting, playing a sport, or just simply getting out of a chair. All of these parts have to be working together in order for you to accomplish these goals. So there are two main categories when we talk about knee injuries. One is structural and the other is functional. So structural injuries are things that we can see on imaging. And this can be caused in a multitude of ways, whether that's a bending, twisting mechanism in a sport or long degenerative changes. For instance, a meniscus tear can occur from a twist on the knee, or getting out of the car, or turning to hit a tennis ball. Whereas arthritis or a tendonitis can occur from long overuse on that knee. So two different types of things, but both are structural in nature, and both can be seen on imaging. So functional problems are more related to how your body moves in a particular pattern, right? So on an image, it's going to be hard to see a functional issue, but what we can do as therapists is watch you move and watch some of the things that you tend to have pain with and find where your deficits are, whether that's in joint mobility or weakness. And what we can do is identify those structures and those limitations and progress them. When seeing your doctor or physical therapist about knee pain, what they're going to help you do is diagnose the problem, determine where it's coming from. And then what we'll do in physical therapy is help formulate a plan to address these issues. So early on, if it's an acute injury, we will really try to address the pain, swelling, and inflammation using different modalities such as ice or heat or electrical stimulation. Once we get out of that early phase of healing and we're starting to progress our range of motion, we'll give you home exercises and stretches to gain further range of motion and restore normal movement patterns. Often accompanied with knee injury is weakness, whether that's the quad or those hamstrings. They're often compromised with any sort of injury. So what we can do in physical therapy is help improve that function and overall strength. And then the last component is returning you to what you want to get back to, whether that's a sport or just being in the office walking around without pain. Our physical therapists at EW Motion Therapy have helped several people overcome their knee pain. Click the link in the description below to see exercises that might work for you. And be sure to talk to your doctor before performing these exercises to ensure that they're safe for you.
If you found this video helpful, be sure to give it a thumbs up, and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.